This is how we do it. Zero an EVD transducer. An external ventricular drain, also called an EVD, is a thin, flexible tube used to relieve pressure in the brain. The brain produces a clear fluid called cerebrospinal fluid, or CSF, which cushions and protects it. Sometimes, due to injury, bleeding, infection, or certain medical conditions, too much fluid builds up, causing dangerous pressures inside the skull. An EVD is carefully placed into the brain's fluid spaces, also called the ventricles, to drain excess CSF. This helps lower the pressure and allows clinicians to monitor brain function. It is a temporary but life-saving procedure commonly used in hospitals, especially in critical care settings. EVDs have multiple positions depending on what the clinician is interested in. You can change the position by manipulating the stopcock, which is a small valve that diverts fluid. The piece of the EVD that converts the pressure signal into an electrical signal displays as a numerical value is called a transducer. The transducer allows clinicians to see intracranial pressure and make medical decisions. The process of calibrating an EVD transducer is called zeroing. There are two methods to zero an EVD. In the first method, you turn the stopcock to the off-to-drain position. The nurse or doctor will then lower the drain to 0 millimeters of mercury, which is level to the external auditory meatus, around mid-ear. The nurse will then zero the pressure on the bedside monitor. Following, they will turn the stopcock off to transducer position, raise the drain, and then return to drainage position. In the second method, you turn the stopcock off to transducer position and open the far end cap to air. Then the valve can be swabbed with betadine and the far stopcock open to air. Following, the clinician will zero the bedside monitor, return the valve off to air, and replace the sterile cap. This is how we do it. How do you do it?